Minister. I welcome the opportunity, and thanks to the Rural Independent Group for the opportunity given us to focus in on this. I must say the only thing absent in their motion perhaps is what has led us to this point, which is the ideology that was permeated, that was promulgated by a lot of parties, that private was best and we privatised the system, and it was of a particular party. But I won't go into party politics, but it is important to say that it is an ideology of neoliberalism that has left us with this mess on our hands. Now, if we're getting sense at this late stage, our Marajershi Dingwelga, Kilkiania, if we have bought sense, that's good. I welcome it. This is a theme that we return to all of the time, isn't it? Like climate change, housing, domestic violence, and we have statements ad nauseum about it, and really what we want is action. So first of all, I want to welcome the fact that you have taken action, Minister, and you took action back in 21 when you listened to the various debates. And you set up in March of 22 a report, the Workforce Advisory Group on Home Carers. I've read that, and that report was published. You received it in September last year. It was published in October, so I give you full marks for that and the work that was done. It's a very interesting read, and it really encapsulates how we got to here. So we have a mess on our hand, and let me pay tribute, as always, to the carers, without whom this economy couldn't function, not to mention thrive. And I always say when I'm standing up that I wish the economists would look at the value of that care and that work to our economy, without which it couldn't function. Of course, it's 90-something% a female as well, which is another indicator of why the money is so low and why no value has been put on it. If we look then at what is the mess that we have a health service providing good money per hour. We have that same health executive providing good money to the private and the not-for-profit not being passed on. You said it was $28.50 per hour. I can tell you there are a lot of carers in Galway that would love $28.50 per hour. So really what has happened with this neoliberal ideology is that we're now helping private companies, however big or small, to make a profit. That's exactly what government policy is. You've inherited that. I know you're on record for saying you would like to change this to have more direct provision, and I welcome that. The findings are absolutely stark. I have only a minute and a half left, so I won't be able to go through them, but they're stark in that review. As well as make pay and conditions, the pay is way too low. We should ensure that there should be a national living wage and so on. At the present time, there's no mechanism for care workers employed by for-profit or non-profit to engage in collective bargaining. And the hourly rate, and I've said this, by the HSE to providers from whom they commission home support and then is provided at a profit, is significantly higher than the rate paid by those providers, those for-profit companies, to their care workers. Something seriously wrong with this. And then we have the report which gives us 16 recommendations, and there are good recommendations, including putting it on a statutory footing. I notice of those 16 recommendations, only one has been implemented, which I welcome, in relation to overseas workers. The one that caught my eye is number 11. All of them caught my eye, but number 11 in particular. There should be a significant increase in the proportion of home support hours directly provided by the HSE. So we're talking about around in a circle where we were providing that from whatever entity was there, which is the HSE now, to changing it to ensure that companies made profit and not provide a proper service, commodified it, which the former Professor Kathleen Lynch has clearly outlined, the commodification of care services. That's what we've done. If you're going to lead us back again, I will fully support you, Minister. Thank you. Can I explain? Yeah. Oh, can I? Just in relation to that ideology, I think it's awful important to identify that we did modify care services. And so somebody in Galway, and it used to be to get them assessed to get home care. Now it's to get the care. There are geographical differences. You can't get them in rural Connemara, for example. And then on top of that, this terrible language, a person entitled to care wasn't entitled to the same carer. So you could have up to 3 or 4 different carers in the day provided by different institutions or entities, all of it based on a neoliberal philosophy or ideology that this made a product out of a care rather than an essential service. And if my colleague from Galway is nodding his head in agreement with them, I welcome that in the sense of changing that ideology. What are essential ingredients of a democracy? And the most basic one is to provide carers directly by the health executive on a living wage. Thank you for the extra time.